I bet Gina has never before been introduced by a dinosaur at a conference.
No, this is the first time.
Doing a voice check. Can everybody hear me? Thank you. As gentlemen mentioned, excuse me, Alyssa had an emergency and is unable to introduce our next speaker. So I am simply going to read the introduction as Alyssa would have read it. Welcome to Virtual Abilities 11th Annual Mental Health Symposium. I am Alyssa Farshore, and I've been in SL for over 12 years, and my passion is I love to decorate. I was born and raised in Canada. I currently reside in Kamloops, British Columbia. I am a diabetic, which has affected my vision and caused cognitive impairments. Since my hiking accident, each year my mobility issues have increased dramatically, and I've had to learn to adjust the way I do things regularly. Today, Genna Mashinchi, MA, will be joining us. She is a doctoral candidate at the University of Montana and graduate research assistant at the Rural Institute Center for Inclusive Communities. She is working towards becoming a clinical neuropsychologist and hopes to work with an aging population in both her clinical and research work. For those of you who don't know, a neuropsychologist is a psychologist who specializes in understanding the relationship between the physical brain and behavior. Genna's research focus is to increase the functional independence of individuals and improve caregiver support. Genna will be speaking about Project Connect and Iterative Participatory Curriculum Development. We ask that you please hold your questions and comments to the end. Keep in mind, Genna is hoping to receive input and feedback from conference attendees, that means you, about the relevance of identified programming topics and subtopics and any potential gaps. It is with great pleasure that I would like to welcome Genna Mashinchi.
Great, thank you so much. Just coming over to the podium now. Thank you very much, Orange. So again, hi everyone, my name is Genna Mashinchi, and I will be presenting on a project that myself and my supervisor, Raina Sage, have been working on. We're working to combat social isolation in the disability population. Can everyone see my slides okay? I think there might be a slight lag because I'm not seeing, oh, you can see the slides. Okay, great. Okay, so without further ado. And like we mentioned in the introduction, I'm really excited to get feedback on how to make this project even better. So really looking forward to your, oh dear, sorry, I clicked the wrong thing. Really looking forward to your feedback. So first, I want to provide some background from the literature that's relevant, and this is all past research that's been done, and I want to kind of orient us. So first, social isolation, which is defined as the lack of social connections, is actually a health risk on par with smoking and obesity, and ranks among some of the top causes of mortality in the US. As a result, the US Surgeon General, Dr. Vivek Murthy, described the rising prevalence of social isolation and loneliness as a public health epidemic. And this is all to say that social isolation is a very serious matter and has a very negative effects on the health of human beings. And so it's really important it's taken seriously. And another important thing to highlight is we're all social creatures and we need to be around others. And that's why this can be so disastrous. And individuals with disabilities have been historically excluded and marginalized from community participation, meaning that they usually have less social support than people without disabilities and tend to report significantly higher rates of social isolation and loneliness. And so although we know these things, there's actually a wide knowledge gap of how social isolation and loneliness can be addressed among individuals with disabilities due to a lack of research and interventions. So there's a lot for us to learn. And because of this big gap, Project Connect, the project that I'm going to talk to you about today, is seeking to fill and learn more. Project Connect is a project focused on social isolation and loneliness within the disability population. The project aim is to create an effective and applicable intervention that can be used by different organizations working with people with disabilities to address social isolation. Projects such as this one that we're doing, Project Connect, can have many different formats, but we chose to use a participatory curriculum development process for the Project Connect, which has also been called the Get Connected project. The participatory curriculum development can be abbreviated as PCD, and I'll be using that acronym for the rest of this presentation, just so you know. We like to use our acronyms, so I wanted to define it first. PCD engages stakeholders, which are individuals with disabilities, centers for independent living, community resources, and others, and they're all interacting in the research process to accomplish two key things. The first is to drive social change and action, and the second is to develop interventions that are effective and easy to use. And it's really important to bring the right voices to the table in this stakeholder process so that those most affected by these interventions are represented and can provide input. And PCD allows for research to be applicable and context appropriate, given that stakeholders helped create it. This process helps for research to not miss the mark and to really fit in with real world applications. So those that are going to be most affected by it are being asked their opinion. So now for our project, Project Connect, we brought together a team of 4 centers of independent living that included staff and consumers. And this project really echoes the mantra that centers for independent living often operate by, which is the nothing about us without us mantra. And this means that individuals with disabilities should be represented in these conversations about changes that will affect them. And so for our project, the 4 centers we're working with include 1 staff member and 1 consumer from Wyoming Independent Living, 1 peer advocate and 1 consumer from Disability Resource Center in North Carolina, 2 staff members from Alliance Center for Independent Living, and 1 executive director from the Center for Independence of the Disabled in New York. So quite a wide range of those who were involved in our process. Before gathering this team, the project team of researchers, all of us at the University of Montana, started weekly meetings in September 2021 after the grant for this project was awarded. And then we finalized our team for participating sites in November 2021. The kickoff meeting with the researchers and the participating site staff occurred in December 2021. And during the first few meetings, we conducted what's called a situation analysis, which allowed us to get a strong understanding of whose voices should be brought to the table to participate, and what opportunities and challenges exist, and what parameters need to be established to make sure the product meets the goals that we're setting with the stakeholders. The situation analysis uses 3 steps. So that's first the stakeholder analysis, which I spoke about a bit earlier, and then followed by a strengths, weakness, opportunities, and threat analysis, which gives the team the opportunity to identify strengths and barriers that could result from trying to conduct the project with the team, and followed by a curriculum fit analysis to analyze the goodness of fit for the project. So after all of these steps, I know it's quite a few, the team begins to identify topics that were necessary to carry out the project of understanding and designing interventions for social isolation. So now we're really getting into the heart of the work. So the topics that were identified, there's 2 for the consumer specifically, included several. So building technology skills, building supports and addressing specific community needs, communication, which includes communication styles and practicing skills for communication, exposure to information, education and time use, which is increasing knowledge kind of overall about those different areas, social skills training, another topic of knowing yourself and learning social cues and being confident, a topic of relating to others, such as understanding the impact of words and managing differences, cultural diversity, which is self-reflection of one's own identity and how to respect others who might have different identities from our own, self-care, which includes stress reduction and well-being, so all of those topics for consumers. And then next we had the topics for facilitators were identified, and those include importance of empowerment, such as consumer autonomy and providing opportunities, meeting people where they're at and setting small goals and building trust, getting over the hump or that difficult barrier, which is helping others step outside their comfort zone or where they are right now. Next is building technology skills similar to the consumer topic, building supports and understanding what resources are available in a particular community, communication and how to communicate and through what avenues, such as Zoom or maybe even Second Life. Cultural diversity, such as respecting others' identities and the intersection of identities, and that could be race and gender, could be religion, could be all sorts of different identities. Self-care, meaning to make well-being a priority. So all of those different topics were identified for facilitators and volunteers. And the end goal of this project is, in designing these topics and conducting these meetings, is to first contribute to the research about social isolation and loneliness in a disability population, and 2, to use what we've learned from these meetings to design helpful interventions to combat social isolation and loneliness in the disability community. So first, to really understand, and second, to design interventions that will help. And now, like I mentioned earlier, now that I've described the project, I would love to hear your feedback about all sorts of different things about this project. What appears to be a good idea to you? What are we missing? So a couple different things. Is there any input? We would love to hear from you. I'll give you all a second to type in the chat.
Dr. Mashinchi, Gentle asks, how does your list of consumer needs relate to the funded mission of CILs?
That's a great question. So a lot of the topics that we picked really align with, again, those values of bringing individuals to the table that will be able to help inform this project and be important stakeholders in the project. We talked about different things like increasing knowledge, increasing communication skills, increasing an understanding of technology. All of those things are really in line with the independent living philosophy of Centers for Independent Living. So really modeling off of that and what our team members at the CILs are acknowledging are important to cover. Great question.
And Sherkin asks, who is deciding who are the right voices? Or perhaps better framed as, what criteria reflects the right voices?
That's a great question. Yeah, so really when we put out the call for this project to bring people together, these were individuals who are doing the day-to-day work at these CILs, so some staff members, the directors, as well as consumers who are directly using these services. So this was really an indicator to us that these would be important voices to have to the table, as these are individuals who are affected by the work that CILs do every day. So yeah, another really great question of how to know who comes to the table. Yeah.
Polaris asks, do you have access to other data warehouses for your research data when collected? How do you get access to those systems?
You know, that's a really great question, and I'm actually not sure of that answer. That's something I could maybe refer to my supervisor for and can follow up with you. I'm not 100% sure on how that is all managed as far as I know for our project specifically.
Gentle Post, a shy community member says, I think from this talk that I'm understanding something drastically different in the UK versus the US health system. Each time she says consumer, she means a disabled person. Not inaccurate, because we do consume healthcare, but we're not that. Start with the wording.
Yeah, thank you for pointing that out. And again, I really should have started my talk with kind of preferencing some of those, the words I would be using, and just maybe some of the differences between the UK and US. And as I've started working here, I've been with the Rural Institute for about 2 years. I've always just become accustomed to the term consumer that's used by CILs. And so I appreciate you pointing that out and clarifying that for this presentation. I also, as we're kind of wrapping up, want to acknowledge our funding that came through this project. That's what's allowing us to make this happen. So it was supported by 3 different grants from the National Institute on Disability, Independent Living, and Rehabilitation Research. The contents of this presentation, like Lily mentioned in her presentation, do not necessarily represent the policy of NIDLR, and one should not assume endorsement by the federal government from this presentation.
Polaris notes, a lot of verbiage that you used was business verbiage.
Yeah, thanks for pointing that out. I think one big thing that comes from working at a research institute is I get kind of enmeshed and involved in a lot of the kind of different research words, and so I apologize for kind of skipping over that. And if there's any other questions of clarification, I'm happy to answer them, but I appreciate your feedback for future presentations I'll give, and really maybe getting less involved in all the jargon that I'm so used to doing on the day-to-day. So thank you for letting me know.
And here's another comment through chat. In Germany, we had to decide social service or army. I think that's missing a little bit in America. Raising awareness would certainly be a good thing. And
Yeah, definitely.
Sorry, go for it.
Oh, I was just going to say, definitely, yeah, thanks for, again, pointing that out. And I think I, again, become so accustomed to just viewing things through a US lens. So I really love hearing kind of the other lenses that are being brought to this conversation in this presentation today. So thank you for speaking up and for sharing those.
Lily Ruthie says a core principle of CILs is consumer choice and control, and the shift was to move away from client, which many folks disliked.
Yeah, that's another really great point, all about language and how language evolves over time for sure too.
And speaking of language, please don't call me a patient. I get so upset with Picori about that.
Yeah, another great point.
Did you see Lula Ruthie's comment?
I see in all caps right. I'm not sure if I missed.
Okay, she said, a core principle of CILs is consumer choice and control, and the shift was to move away from the client, which many folks disliked.
Yes, sorry, I had to scroll up a little bit. It's nice that our chat has been so active in this presentation. That's another great point, and I appreciate that being pointed out again, that that shift in language and choice and how that all aligns with the Center for Independent Living mantra and philosophy.
There are a few comments here about language, which is really interesting. Let's see if I can scroll up. Terry says, I confess that I thought that the jargon was overwhelming. Polaris says, I'm used to the jargon. Sherkin says, thank you for the energy, effort, and understandable presentation. Languaging is critical. Neutral languaging is a crux point for passing on brilliance. I like learning from you.
Oh, thank you very much. I appreciate you saying that.
And Luke has a question. Quote, cultural diversity, respect for other people's identities, and the intersection of identities. Would you be looking at the weighting individuals give to various intersections of their identity and how differences in weighting would affect the results that you'll get? For example, my identity would be 80% ASD, 10% British, 10% female, in that order. How would different pyramids of identity affect your reading of data, results, and support techniques?
Oh, that's a wonderful question. Thank you for pointing that out. I can speak to some of the work I've done in psychology in particular about social identities and those intersections. And I think the point you bring up about having those different weights is such an important conversation or aspect of this that hasn't really been discussed yet. It seems like a lot of the intersection work in literature I have read comes from just it seems almost like they're not weighted. And you bring up such a great point about different weights in identity and different identities and how that can change among people. Maybe two people having similar identities, but the weights being different. And so, I actually really haven't heard a lot about that, and I'm really glad that you brought that up so I can continue to look into that and propose it in future conversations. So thank you very much for bringing that up.
Dr. Ibsen says, building on this conversation, we are seeking a shift from person-first language and toward disabled-first language.
Yeah,
and
that's
just, sorry, go ahead.
I was just going to say, yeah, thank you for bringing that up. That is something that we've talked about in the research world and using language and the changes that are coming. A lot of it comes from journals we submit publications to and what the preference is. And also we've talked about just hearing from others which language is preferred, person first or not. So we have noticed a shift in the preference in the literature.
And dental comments, interesting, Catherine. Who is the we that is shifting? And Lulu Ruthie says, love this idea of identity pyramids. And Becky Ibsen responding to Gentle says, Gentle, that we is coming from journals or different places we publish information, and should have typed seeing, not seeking.
Wow. This has been quite the day. What an amazing session, Genna. Thank you so much. You've got a lot of conversation going here.
Yes, I'm
Any
so
last questions,
thankful.
gang? Last questions.
Well, thank you everyone for your time and for your input. I really appreciate how we were able to have a great conversation this session. So thank you.
Craig, that is a